In this tutorial, you will learn about the historical and modern approaches of using psychosurgery to treat mental illness. The learning objectives for the tutorial are as follows. Describe Howard Dooley's experience and how it relates to the history of psychosurgery for the treatment of mental illness. Define lobotomy and distinguish between standard and transorbital lobotomies. Identify the effects of lobotomies. Identify Dr. Walter Freeman's role in the widespread use of lobotomy. Identify two modern forms of psychosurgery, their uses and limitations. Howard Dooley was born in 1948. His mother died when he was young, and he was deeply affected by her death. He recalls that he was never explicitly told that she died, and therefore he believed she abandoned him, and he was always afraid that his mother didn't love him. Howard's father remarried Lucille Lou Dooley when Howard was 7. Lou was very strict with Howard and often spanked him when he misbehaved or was rebellious. As a preteen, Howard was a troubled child and often acted out when he was bored at home or at school. He was often disobedient and stubborn, but he was never violent toward anyone. Although his grades were at times erratic, he was not failing school. However, his stepmother, Lou, was frustrated with his rebellious behavior and his unwillingness to conform to house rules. She became convinced that Howard had a mental illness. By 1960, she had taken Howard to see 6 psychiatrists who all agreed that he was normal. In fact, they believed that the problem in the house was Lou herself. Unsatisfied with their diagnosis, Lou had Howard evaluated by the eminent neurologist Dr. Freeman. Dr. Freeman was a neurologist who at the time strongly advocated using lobotomy to treat mentally ill patients. According to Freeman's note, Lou Dooley said she feared her stepson, whom she described as defiant and savage-looking. He doesn't react either to love or to punishment, she told Dr. Freeman. He objects to going to bed, but then he sleeps well. He does a good deal of daydreaming, and when asked about it, he just says, "I don't know." Lou was strongly convinced that Howard was mentally ill. Although Rodney Dooley, Howard's father, did not agree with his wife's assessment, he stated that Howard's unpredictable behavior was a constant source of puzzlement to him. After meeting with Howard 4 times, Dr. Freeman could not find anything wrong with him. In fact, an official diagnosis did not occur until months later when Lou claimed that she feared for herself and for her family's safety. At that time, Howard was brought in for another interview during which Dr. Freeman diagnosed him as being schizophrenic. Dr. Freeman recommended a lobotomy as a way of changing Howard's personality. Howard was admitted to the hospital for a transorbital lobotomy when he was 12. At that time, Dr. Walter Freeman was a leading expert in the field of lobotomies. In fact, he created the so-called ice pick lobotomy, a portable and inexpensive method as horrific as it was convenient. Dr. Freeman believed that anyone could be taught to perform this new operation in just one afternoon, and he began traveling the country's mental hospitals on what he called headhunting expeditions in search of more patients to use his ice pick lobotomy upon. In a lobotomy, doctors severed neural connections between the brain's prefrontal areas and the rest of the brain. These fibers were believed by doctors at the time to promote excessive emotions. There were 2 common procedures for lobotomy, the standard and the transorbital lobotomy. In a standard lobotomy, a surgeon saw 2 holes in the skull and inserted a slender device into the brain. With the tool inside the brain, the doctor then exposed the cutting wire and rotated it to sever neural fibers. The procedure was then proceeded in a second hole to destroy more fibers in the brain. In a transorbital lobotomy, a doctor inserted a tool similar to an ice pick beneath the eyelid and hammered it into the brain through the thin bone of the eye socket. The doctor then toggled the instrument to make cuts in the brain. This procedure was then repeated in the other eye. The results of early lobotomies were difficult to interpret because many of the people receiving them were already psychotic, severely disturbed, or out of touch with reality. However, the main effects of lobotomy tended to be mental dullness, childlike personalities, and a lack of emotion. Oftentimes, people were not able to live independently after having lobotomy. Increasingly, mental health professionals of the time became concerned that lobotomy was being used to control disruptive patients living in mental institutions, which at the time were overcrowded and somewhat chaotic. By 1949, the number of lobotomies performed in the U.S. using Freeman's ice pick method soared from 150 to 5,000 annually. Before his death in 1972, Walter Freeman would go on to personally lobotomize more than 2,000 people, including 19 children under the age of 18. Howard Dooley was one of those children. After his lobotomy, he woke up from his operation having no idea what happened to him because he had not been told that he was going to be lobotomized when he had been taken to the hospital. He writes that he woke up in a fog, and I don't remember really being in pain. I don't remember being unhappy. I don't remember much of anything. The fog, which Dr. Freeman referred to as the echo period, was typical for lobotomy patients. Later, family members stated that Howard was lethargic, lazy, and stupid. One aunt said that he acted like he was permanently sedated. Yet his stepmother was still unhappy with his behavior and reported that he continued to behave erratically. In 1963, Howard was placed into juvenile penitentiary. Afterwards, he was transferred into an asylum and eventually put into a boarding school for the mentally ill. At 15, he was abandoned to state care by his family. When he finally released from care, he became an alcoholic and was incarcerated for a period and eventually became homeless. However, later in life, Howard became sober, got a college degree, and became a state-certified behind-the-wheel instructor for a school bus company. He also married and had 2 sons. In his 50s, Howard began to research what had happened to him as a child, and he eventually wrote a memoir detailing his life experience. Modern techniques of psychosurgery have evolved substantially since the lobotomies of the 1960s. After 1954, psychosurgery was largely replaced by drug treatments. However, today, recent advances in neuroscience has brought about a small resurgence of psychosurgery. However, today, psychosurgery is generally only used as a last resort in severe cases of neurological oriented disorders such as Parkinson's disease, obsessive compulsive disorder, and depression. Psychosurgery is reserved for extremely ill patients today who have failed to respond to at least 3 types of medication and for whom months on the counselor's couch has had little to no effect. One modern form of psychosurgery is the anterior cingulotomy. That's a hard word to say. Currently in the U.S., this procedure is only FDA approved to treat people with severe obsessive compulsive disorder, a condition imaging studies have shown to be linked to an area of the brain known as the anterior cingulate cortex. In this procedure, a brain surgeon uses a laser to destroy 2 to 3 centimeters of white matter at the anterior cingulate cortex. This disrupts transmission from the frontal cortex and reduces symptoms associated with obsessive compulsive disorder. Most OCD patients do not qualify for the surgery, but for those who do and have undergone the procedure, about half of them have seen their brain functioning improve to normal. Some research suggests that psychosurgery such as this procedure via laser could be an effective way of treating depression, although this has not yet been given the FDA stamp of approval. A second modern form of psychosurgery is deep brain stimulation. In this procedure, electrodes are implanted in various regions of the brain, and electrodes are connected to an electrical device that sends out stimulating electrical pulses. Although this procedure is less potentially damaging than other procedures, potential risks of it are infection, seizure, personality changes, dementia, and memory disturbance. Long-term risks are unknown at this time. Traditionally, it has been, again, reserved for the use of Parkinson's disease, major depression, and OCD, or obsessive compulsive disorder. In summary, after 1954, psychosurgery was being replaced by the rise of drug therapy, largely because early techniques of psychosurgery, such as lobotomy, were largely ineffective and dangerous. Many patients experienced severe reductions in their cognitive abilities after having lobotomy. Also problematic was that psychosurgery was often used to control people whose behavior was disapproved of by others, such as Howard Dooley. Howard Dooley's case exemplifies the importance of accurately diagnosing and defining normal and abnormal behavior. It also exemplifies the importance of support during and after the treatment of mental illness. Howard's life after his treatment was not unusual for those living with lobotomy. His abandonment by his family and his lack of support both before and after his lobotomy significantly worsened his condition. Modern techniques of psychosurgery are based upon scientific advances in neuroscience. Psychotherapy today is limited, psychosurgery today is limited to severe cases that have not responded to drug therapy or psychotherapy. Although modern psychosurgeries sound and are extreme, the neurosurgeons who practice it argue that the benefits for people with severe psychiatric illnesses are worth the risk, and these procedures may be the best chance that the sickest patients have at recovery and a normal life.